We also are very pleased tonight to have Jim Mancini, who's our speaker. And I want to tell you a little bit about Jim. Jim earned his MS in Speech and Hearing Sciences at the University of Washington in 2001. He's worked as a speech-language pathologist in both research settings, such as Kennedy Krieger Institute, as well as clinical settings, like the UW Autism Center. He's currently a speech pathologist, language pathologist, coordinator of parent education and support at Seattle Children's Autism Center, and he maintains a private practice. He specializes in assessments of children with ASD, autism spectrum disorder, language disorders, motor speech disorders, and other neurodevelopmental disorders. He's a frequent and I hear very popular speaker at local outreach events, including Children's Autism 200 series. So we're very pleased to have you tonight to talk to us about speech and language and communication.
All right. Now, is this working? Can you guys hear me perfectly? Awesome. So I just want to thank you all for inviting me here, and I'm excited to be able to talk a little bit about these words, right? Speech, language, and communication. You know, a lot of times we just think of them all as being the same thing, right? We use these words interchangeably to describe language or speech or communication, whatever we want to call it. So before I jump in and get started, I'd just like to get an idea of who is in the audience. So could you just give me raise your hand if you're a parent? Your role here as a parent of a child with a disability. Just one? Two? So how about teachers? Teachers from the school systems? SLPs? All right, good. How about psychologists? Terrific. How about nurse practitioners? Couple? Awesome. Any physicians? Okay, occupational therapists? How about students? Awesome, beautiful. How about students who are interested in pursuing a degree in speech-language pathology? One. Okay. Talk to you later. Okay. So, you know, let's talk about our objectives.
You missed us.
Oh, yeah. No, please tell. Who did I not talk to?
We're school bus drivers.
School bus drivers. Now, that is the best group I've had at one of my talks. That's awesome. Okay.
For special needs.
For special needs. That's terrific. Thank you for coming. So, what we're going to start by this evening is just defining what these three very different words mean. Okay, so we'll do that tonight, and then what I want to spend some time on is talking about what we think of as social communication. Okay, so I'm going to present a model, and then really kind of talk about some different how social communication manifests itself beginning at an early age and all the way through older children. We'll talk about some common communication disorders that we see in children, and then I'll give you a couple of strategies that might be helpful, especially in terms of social communication development. So we've got about 90 minutes, right, until 8:30, and I want to leave time for questions, so I'm going to try to we'll probably leave 10-15 minutes at the end for questions, but if people have burning questions at 8:31, I'm happy to stay and talk. So these different words, right? So speech, when we think about speech, we're going to talk about all these individually, but speech, it refers to the motor movements, right? Speech refers to the sounds that we create with our mouths, okay? So that's one thing. An SLP is going to really delineate these things as being quite different from each other, okay? Language refers to the understanding and the expression of the symbol, right? A language concept of a vocabulary word, right? And grammar in terms of how we put words together. And then when we think about the word communication, it refers to how we use those verbal skills to communicate in social contexts, right? And there's verbal communication, but we also know that nonverbal communication is also quite important when we think about how we interact socially, right? So, so let's start with speech, okay? And as I said, speech refers to those oral motor movements. It requires the coordination of quite a lot of different oral structures in your mouth, okay? It involves the coordination of your breathing, that the air has to come out from your lungs. It involves all the oral motor muscles as well as all the articulators, and I've got a really nice diagram I'm going to show you in a second. And then we'll talk about, and what speech follows is a developmental pattern. So how many parents, just period parents, are in the room? You have had children. So, okay, so you guys got to see your kids develop their speech, right? And, you know, you saw them have a lot of really cute articulation errors, you know, when they were little, and then they slowly learn to develop kind of more appropriate and intelligible speech, right? So when we look at this diagram, I'm just going to come back here and just sort of point some parts out. So, you know, the lungs are way down here, right? The air has to come up through your lungs, and then when that air comes up, you have something inside your larynx called your vocal cords, right? And your brain sort of has to tell all these different motor movements what to do, okay? So the air comes up, you either turn on your vocal cords or turn them off, okay? The air ends up coming up through into your oral cavity, okay? Some sounds actually come out through your nose, right? So if you go or right, you're actually blocking the sound off, and the sound actually comes right out of your nose, okay? You use your teeth, you use your tongue, right? There's this soft palate right back here, right? And would anyone be able to recognize what a uvula was, okay, before tonight? Okay, it's important. So when you're saying your M and N, this comes up on every sound except when you're saying M, N, and the NG sound, like in the word swimming with the NG at the end. So what this involves is a lot of complex motor movements, right? And when you're able to say a simple word like ball, right? The B is a voiced sound, so B means that you're turning your vocal cords on for a second. All vowels have your vocal cords on, and then you're saying ball, right? So that's one sort of, you have to tell your mouth to put your lips together to make the B sound, right? You turn your vocal cords on at the same time, and then you kind of you open your vocal cavity up to say the sound, and then the L is kind of a sort of semi-vowel, so it's kind of in the same sort of way, ball, right? Now when you say the word basketball, now you're starting to increase the coordination, right? You increase the needs of what you need to be able to do, okay? To coordinate all of these different sounds, right? So when we think about speech sound development, we can look at these as being what you expect to see at certain ages, right? So at the age of 3, you hear these very easy sounds to make, the B's, right? The M's, the P's, right? And just to kind of give you a quick example of the difference between a voiced and a voiceless sound, when I say ba, 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 and pa, 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 right? The ba is a voice sound. I've used my vocal cords to make that sound. P is formed exactly the same way, right? Except the vocal cords are off. So if you guys want to try it, anyone want to try it? Right, say ba, ba, ba. Now say pa, pa, pa. Right, beautiful. So nice job. So then by 4 we have some more sounds, and that's when you start seeing lots of 3-year-olds are pretty hard to understand, right? They use a lot of word approximations, right? They might make a lot of articulation errors, right? So about 4 and 5, most people are starting to be able to understand these kids, okay? And then when you hit 6 or 7, you might hear what we think of as very typical articulation errors, right? The mistaking the R and saying W, right? So it's wed, for example. TH is a hard one. L and S, those are the ones that often our kids haven't mastered until 6 or 7 years of age, okay? So that's the sort of typical speech sound development. Now we have issues that we would consider disorders of speech, right? And again, this is just the motor coordination problems, right? Or difficulties that are due to muscle weakness, right? So a very common disorder is called apraxia of speech. And apraxia is simply difficulty coordinating all of these complex motor movements that are necessary for speech. So when we think of kids who have apraxia, they are characterized by having a lot of atypical errors, right? When we ask them to say longer things, longer sentences, longer multisyllabic words, they have a hard time being able to coordinate all of that because we're asking them to do something that's what's called more linguistically complex, right? So, but when you ask them to say simple words or words that they practiced a lot, then that becomes easier for them, all right? So that's apraxia, and we're going to talk a little bit about how to help apraxia in a minute. Dysarthria refers to speech disorders that are a result of muscle weakness. And very often these cases are what we see after maybe a person's had a traumatic brain injury, right? Often stroke victims when they're older, older person who had a stroke might have slurred types of speech, or a child who has cerebral palsy often has dysarthria, and that means that their muscles simply are too weak to be able to effectively produce the sound. Okay, so, and then finally we have articulation and phonological errors, and I know there's only one SLP in here. This is actually quite a debate about, is phonology is the rules, being able to the system of sounds, right? And then articulation is that it's all motor-based, right? So if this was a whole room of SLPs, you'd have 50% of people who thought it was phonology, and 50%, so you guys could be the articulation people, and you guys could be the phonology people, and then you could just fight the whole time, okay? But I'm not going to go there at all in this particular evening, okay? So when we think about what to do, right? And apraxia is quite common, so I like to spend a little more time with that. And it really refers to what the treatment really entails is lots and lots of practice, right? So when we think about how to create a motor plan, so has anyone ever had to learn how to do a dance? Like a swing dance, or having to do, a waltz or something like that, okay? So when I got married, we decided to have a swing band for my wedding, okay? And my wife had danced since she was a little girl, right? She had taken modern dance and jazz dance and ballet, so she was a good dancer, right? Me, I had never danced. I had never taken any sort of formal dancing. Of course, in college I liked to dance, but that's beside the point. So, but when you go to take a swing class, right, you have to do what's sort of the basic step, okay? And it might be something like one step forward and then one step back, or something like this. I think this was it. It was one step forward and then back like this, okay? And if you have never learned to, never took dancing and this is your first time, then you have to sit there and think, front step, second step, back, and then this, right? And you have to really be deliberate and think about how am I going, where am I putting my foot? I have to be able to do this in the right order, right? And you kind of get mixed up, and it takes some practice, right? But after a while, it becomes automatic. You don't have to think about it, right? You can do this basic step automatically, right? And then what's really cool is once you've mastered that first step, then you can add new steps, right? And the same concept is true for speech development, right? So when we think about how do we create a motor plan, we try to help them, and sometimes we might use physical prompts by touching a child's mouth, maybe helping them push their lips together to create an O sound or a B sound, or maybe helping them be able to recognize where sounds should occur or take place in their mouth. So if a G sound takes place way in the back of your mouth, right? And lots of children have a hard time being able to produce that sound. So what we try to do is figure out if there's a way that we can kind of physically prompt them or help support them so that they are producing the sounds in the correct way, right? We start small, we start simply, and then we add new sounds, right? Or we increase the complexity. So, easy sounds, easy words to make, B, right? If I said baby, that's pretty easy, right? And lots of kids will start by saying things like bib, right? Or cake. It's the same sound at the beginning and the end of the sound, of the word, right? Those are the easy ones. So we start there, right? And then we're going to say, all right, now he's mastered cake. Now let's move to cat and K, but then I've got to get the T, which is formed right at the front, right behind my teeth, cat, right? So we try to help them until that we start expanding. But just like dancing, right, it becomes easier as a child has a certain number of motor plans, okay? So that's kind of what the general idea of treatment for a speech disorder like apraxia, right? Dysarthria is kind of harder, so because sometimes the child has a muscle weakness that we can't correct, right? It's very hard to correct, increase the muscle strength in a child who has cerebral palsy, right? Or maybe they just don't have the correct range of movement, right? They're just not able to make these movements, right, with their muscles. So you try to do your best to increase the strength and range of movement. Later we'll talk a little bit about, well, what if a child can't speak, okay? What are the options there? And sometimes we look at alternative or augmentative types of communication, and that is very common in kids who have CP, okay? So that's pretty much it. Speech is easy, right? Speech is the kind of quick one for me, all right? Does anyone have any questions about speech or speech development? We're going to put speech over here. Yes, one question.
I'm just wondering, so with treatment, is there a certain period of a stage, I guess, in their childhood development that they will develop most with the treatment of speech? Like, you know how some say with language, that kids will pick up it better when they're younger, and as they get older, it's more difficult. Is that
I see what you're
similar
saying. You know, I think that speech therapy for speech isn't that easy for a child who's under 3. I guess that would be my sort of judgment. Lots of times, to be able to practice like this, a 2-year-old doesn't necessarily, getting that practice is harder. They may not be that willing to do it, okay? Whereas language therapy, when we talk about it, we can start at a really early age, okay? And lots of times, frankly, unless a child's pretty nonverbal and not making any sounds, even in 3 is you don't expect them to be that, having that many sounds. Does that make sense? So, I think that there's not like a point where they just have this burst of sort of speech development. I think it just kind of depends.
Can I speak to that for just a moment? We have a whole campaign that we run called Babies Can't Wait in the world of early intervention, and I'm here as a parent because I have a son with autism, but I also work as a family resource coordinator in birth to 3, and our speech team uses as a guideline roughly 18 months before we can really make much of a difference with apraxia at all. And that's kind of a very, very broad general guideline. At about 18 months, they go in, they spend a lot of time on the floor, and they chase 2-year-olds day in and day out, trying to meet kids where they're at and work with them with whatever interests them to promote the practice that you're talking about.
Yeah. I mean, creating goals like imitation goals can be a really good way to start, and then you kind of really build imitation, and when they are imitating well, then we can work on verbal imitation when they're willing to practice.
And a lot of what they do is try to teach the parents what they need to continue after they, if they spend 50 minutes a week, they're lucky with a child, but if they can give the parents a model of how to continue that practice and use that practice as motivation for a child to make choices in their everyday life, then they can get a lot of practice in a child's natural environment and really make some strides and get a child ready for the speech therapist at 3.
Yeah, I think that's a good point. So let's move into language, okay? And when I think about language, language refers to symbols, right? Every word that we say is actually just a symbol for something else. It represents a thing or an action, right? Even concept, ideas, emotions, right? They're simply words that we create to be able to symbolize an idea that we have in our mind, okay? So it involves word meanings, which include, these are all sort of synonyms here. So when I say word meanings, that means their vocabulary, or we call it semantics, all right? When we think about the structure, we're talking about grammar. How do I put words together? Our English has a system of rules that govern how words can be put together. We can't just throw words together haphazardly and expect that it's going to make sense. Okay, so I'll start with this. All right, everyone can read this word, and you have this symbol. When you read this to yourself, a picture pops into your mind of what it is, right? And it really is just an arbitrary collection of sounds. Apple, right? Who decided that was what we're going to call that? Okay, but someone a long time ago said, let's call this an apple, you know, and it ended up sticking, and that became a shared understanding. It was shared meaning around this thing. Okay, so who knows what that is? Anyone? And anyone? You can read Mandarin? That was good, though. That was good. Yes. We'll talk about inferencing and predicting later. Okay, but she's absolutely right. Okay, pinguo. This is a word. Okay, if you spoke Mandarin, you'd have a picture pop into your mind. Okay, so did anyone have a picture of an apple pop in their mind? Okay, great. So, and there it is, right? So that was it. So talking, you know, when we think about different languages, it provides a good example, right? So one word in English has a different word in Mandarin, which has a different word in Spanish, which has a different word in Vietnamese, and has a different word in Somali, right? So language refers to the ability to create this system, right? So we'll start by talking a little bit about receptive language, your understanding of language or comprehension. So it involves your vocabulary, all these single words that you know, right? And not just objects, right? But also action words, as well as all these descriptive words, relative terms. You know, you can have a big ladybug and a tiny elephant, right? But when you compare them to each other, they're different, right? I mean, so that's the kind of things that those types of ideas need to be expressed in language and using words. So things that we look for when we're thinking about or assessing receptive language skills, we look at the understanding of those words, the understanding of grammar, right? Do you understand the rules that govern how we put words together? Can you follow verbal instructions? And this is a big one, right? This is one of the things that when I'm doing assessment, I'm often asking the question, how complex can directions be that your child can follow? As well as being able to answer a variety of WH questions. What, where, who, how, when, why, right? They follow a developmental pattern as well. So if your child can respond to or demonstrate understanding of early ones like what and where, that's good. And then we want them to be able to later understand a how question. Well, how do you brush your teeth? Or how do you brush your hair, right? And then later, even why, you know? Why do we have to go to bed at 9 o'clock, right? Why do I have to wear a jacket today, right? So, and then finally when, you know, understanding time concepts of things like that. So later, we expect kids to be able to make inferences, understand expressions and idioms and figurative language. So all of this gets put into what we think of as receptive language. Two questions to ask yourself is, what's the impact of attention on a child's receptive language skills, right? As well as when we think about, especially when we think, and I come from the world of autism, so I often see things through this lens, And when we think about children with autism, we often think about their ability to respond socially, their motivation to socially respond, and that can have an impact on receptive language. So when we're doing an evaluation, we're going to probably take a look at their attention abilities. We're going to look at how motivated, do they respond? Do they understand the words, but they're just not motivated to respond to us in this moment? Or do they truly not understand the words, right? So those are good questions and things that we look for when we're doing an evaluation. And then on the flip side, so we have to understand, we have to be able to take in all this information, but then we have to be able to produce it ourselves. We have to be able to express our language, and that's the other side. So when you are looking at a speech and language evaluation report, there's always going to be, this is their receptive abilities and this is their expressive abilities, right? And often they differ, and we'll talk about that just a second. So similarly, we have your expressive vocabulary, right? And I just kind of include in here, this doesn't mean just the knowledge of a word, but what do you know about that word? When I say the word spoon, right, you could also say, well, what class of thing does a spoon fit into? Well, it's a utensil. And what do you do with a spoon, right? Well, I use a spoon to scoop my yogurt in the morning, right? You have to have this knowledge about, not just the word and the picture in your mind, but also like, how does this relate to other things like forks and knives, right? Does it have, do you know the riddle, hey diddle diddle, right? How does that, what kind of knowledge does spoon have in that area, okay? So that the vocabulary isn't just single words, but also the breadth or the vast knowledge about those vocabulary words. And then grammar, and this is where expressive language becomes really important. So there is, there's objects, nouns, right? Verbs, descriptive words. In English, we have a system in which we put these things together and put these words together. And children at an early age start recognizing and understanding that system, right? So very often the first children, when they're developing language, they have a lot of single words, right? And at about 50 words, they'll start to be able to put these words together creatively. And what research has shown us is that they have predictable patterns in which they put words together. One is called an agent plus an action, right? A noun plus a verb. Doggy, run, right? Daddy, kick the ball, right? So another one would be action plus object. And that one, kick the ball, throw the ball, right? Another one might be the possessor plus their possession, right? That's daddy key or daddy car, right? So there's these predictable ways that we start putting words together, and then we start adding more words, right? And then we start adding maybe descriptive concepts like colors or size concepts, right? Or then we can put adverbs in there and talk and describe describing actions like, well, that dog runs quickly, right? So that's what grammar is. And then later we also think about the organization of language. So we're happy when kids are able to put a sentence together. And when a child produces a full sentence, that's sort of a big deal for us, right? But it goes beyond that. A child has to be able to link sentences together so that they make sense when they're explaining something, right? Or telling the sequence of how do you brush your teeth, or relating what happened at school that day, right? So expressive language has a very important component to how we interact socially, right? So, and then we do one of the questions that we will ask is, so we have this speech section over here, this little speech bubble. So when a child has speech deficits, how does that impact their expressive language? And often it does have an impact. A speech deficit very often doesn't have an impact on their understanding or receptive language, right? Okay. So a question that we always ask ourselves is, is there a gap between a child's ability to understand things and their ability to express things, right? And questions we'll ask ourselves is their expressive skills lower than their receptive? Okay, so that one kind of makes sense, right? Your receptive skills are up here, your expressive skills are down here, right? Maybe you have an expressive language disorder, maybe speech is an issue for you, right? And how would you be able to express more than you understand, right? This doesn't make any sense, right? But what we sometimes see, and this often happens in kids who are on the autism spectrum, is we get a language test back from them, and their expressive abilities are in fact higher than their receptive skills. And that's puzzling, right? So what we think about that is, well, there's that attention question again. Are they not attending to what someone else is saying? Are they not responding socially to what someone else is saying? And that is actually what is giving them this receptive language delay on a standardized test. So another thing I'd like to talk about, and this is also relates to children who have autism, is most of us have read the books, right, that say what to expect in the first year. We know these developmental milestones. Any parent here probably has read, all right, this is what I expect by 6 months, at 12 months, at 18 months of age. So when we think about speech and language development, there's this trajectory, right? The milestones that we expect. And we can think about children who have communication deficits as being kind of typical delayed, but there's also this group of kids who we would consider to be atypical communication developers. So a child who might be typically, developing along this typical pattern will meet those developmental milestones, but they're just going to hit them a little bit late. So instead of talking their first words at 12 months of age, they use their first words at 18 months, or 2, the classic late talker, right? What you might see is a real varied vocabulary. Even though the child's developing their language late, they still are learning more than just object words. They're learning the actions and these other concepts as well. And when we get to nonverbal communication, we'll kind of come back to this, but what a lot of children will do is, when they're not able to communicate verbally, they compensate by using nonverbal abilities. They use a lot of gestures. They may use pantomime. Sometimes they are the most skilled communicators because they can get their point across even though they don't have a lot of words to be able to use. So that might be this typical delayed pattern of development. Sometimes we see, and again, this is what we see in kids who have autism, is atypical language development. So instead of taking this, going along this developmental trajectory that looks like this, they're just doing it in their own way. They've got their own plan, they've got their own style of how they're learning language, and it looks different than many other children. And very often these kids will meet up at the same spot later on, but they just kind of took a roundabout way of going. Sometimes kids who have this type of pattern also continue to have many, many difficult communication deficits. But it can be just their way of learning communication. And a good example of that is what we call echolalia. So echolalia refers to repeating the speech of other people. So very commonly seen in children who have autism, you say something like, "Do you want some juice?" And they say, "You want some juice?" Right? And what that is they're affirming, they're using repetition as a way of saying, "Yes, I would like some juice, please." Right? Or maybe they've learned something from a movie, or they've learned something that their mom or dad says, and they just learn it as a whole chunk. So it's this kind of maybe scripted communication that is functional for them, but is hard for other people to understand. So what often happens is they might use this memorization, and very often children with autism have these amazing memories that they can utilize, and that's probably one of the reasons they decide that this is how they learn language, and they'll start to slowly be able to be more creative, be more formulated, kind of like what you see in this side. Okay, so when we talk a little bit later about social communication and we talk about how the evaluation, I'll bring this back up again because this is kind of an important point when we think about how are we identifying the kids who may have deficits, right? Or what we would call differences in their communication. Okay, so some common disorders of language. Receptive language disorder is the not understanding a deficit in their comprehension of language. Sometimes you can see that, and whereas their expressive language is higher, it's not that common, but it can happen. We sometimes might call that auditory processing disorder. If people have heard of auditory processing disorder, that can be thought of as a kind of synonymous with this idea of receptive language disorder. Expressive language disorder is when your receptive skills are normal or within normal limits, and then their expressive skills are lower. And then commonly we will see both, a mixed receptive and expressive language disorder. So what we do, and when I'm teaching a class to parents, and that one of the things that I do the most over at Children's Hospital is I spend a lot of time trying to teach parents shortly after receiving a diagnosis of autism about some strategies that might be helpful for them to help encourage communication and social abilities. And the best thing we can do is just provide a lot of models and try to encourage and facilitate imitation of language. So we think about replacing something that is less sophisticated, is immature, and be able to provide a model and get them to imitate, and what we think of as replace those immature ways of communicating with things that are more complex. Kind of a quick example, some children with autism will take your hand and lead you places, right? Or take your hand and take your hand and put it on something as a means of communication, right? Usually to request, I would like some of this cookies, please. You know, so there's a jar of cookies and they want to open the cookies and they can't do it, so they take your hand and put it on the jar, right? So what we would want to do in that situation is not really allow them that to work, and then try to encourage them to communicate in whatever way would be appropriate for them. Maybe it's just pointing, or maybe it's handing the jar over to ask for help, right? And whatever would be a little more mature, a little more sophisticated is what we want to try to do. Two other strategies that are helpful. One's called parallel talk, and this is what a lot of parents will do when they are, the child is doing something, and maybe say they're playing with trains or they're building with blocks, right? We give them the words that would apply to whatever's happening at that time, right? So they're rolling the train, or the train's going up, right? Or we're stacking the blocks, or that's the red block, and that's the green block. So we're providing a lot of a sort of a language-rich environment where they are getting access to these symbols, right? They're beginning, and it's starting to make sense to them because it's what they're doing at the time, and they're hearing it's almost like they've got a play-by-play commentator who's just telling them exactly what they're doing at each moment, okay? Self-talk is similar, but it's what the parent is doing, and often is used effectively when a child is watching the parent do something. Say I'm sweeping the floor, right? I'm just going to sweep the floor, or very often supermarkets is a great example, right? Oh, looks like we need some apples. Let's count the apples. 1, 2, 3 apples. We'll put them in the bag, right? So we're just doing a lot of self-talk in terms of what I'm doing that's providing models for language so that the child can understand. So evaluation of speech and language, we when we think about psychology and we think about a lot, motor development, when we think about how we measure a child's, where they are in terms of their abilities. We often use standardized assessments, and we use that are norm referenced measures. So same thing with speech and language. There's a lot of measures out there that examine a child's receptive abilities versus their expressive abilities. Some of them go all the way through adulthood, and will examine specific areas like vocabulary or inferencing or syntax or whatever. And they do a pretty good job, okay? So we want to make sure that we're using informal measures. We want to make sure that we're taking parents, do a nice parent interview so that we get information about what the child's doing themselves, as well as if they're in a teacher, if there's a teacher there who can also provide information, and then try to do observational assessment as well. So that's what a sort of classic evaluation of speech and language would look like. So, and here's just a couple of strategies that might be worthwhile taking a look if you're interested in these. Language, the Hannon Center is a group out of Toronto, and they have they train speech language pathologists and on specific strategies that really provide language encouragement. So one of their books and one of their programs is called It Takes Two to Talk. And then PROMPT refers to a treatment for speech disorders that is specific to a child who might have apraxia. Okay, so I wanted to kind of get through that as quickly as possible because I want to spend a lot more time just kind of talking about, all right, so we've got these language skills, we've got these speech skills, but how do, in what context do we use these, right? None of those, we wouldn't use any of that if it wasn't for a social reason, right? And that's what when we think about communication, now we're talking about the how and the why we communicate. Why do we use those language skills? How do we use those language skills, right? To be able to communicate socially. And this is important in terms of everything we do every day, right? Peer interactions, right? Development of friendships, day-to-day interactions. You go to the supermarket, right? You're even some guy, who's driving by you on in his car, you can have some communication there, whether you want to or not. So let's talk a little bit about what we think about as social communication. And this is fairly it's not a new idea, but it's getting a lot more attention than it used to in the past, especially when I went to school, which is only 10 years ago, 12 years ago now. Most schools were really focusing on language, right, or speech. And assessments would be conducted that would look at a child's language ability, their vocabulary and grammar. And there wasn't as much attention to what we think of as social communication, okay? But it really is starting to become much more identified, much better identified. I think it has a lot to do with the increased awareness of autism, is that social communication is such an important part of what autism is, and how do we treat that, especially in some of these kids who they don't have a lot of language delay. Maybe they don't. They learn vocabulary and grammar even on time, but they have deficits in this area of social communication. So I want to start with just a model. And this comes from the University of Washington. Leslie Alswang and Truman Coggins are researchers in the speech and hearing department at UW. And this model has been around for a while. I think this model is probably 10 or more years old. So, and what I'm going to do is, you see all these boxes. What I'm going to do is we're going to kind of go through each of these boxes and just kind of explain a little bit about what that means, because at every part of this, you can identify this may be where the breakdown is occurring for an individual child who is demonstrating a social communication impairment. So just to kind of go through the model quickly, we have to be able to process information. We take in information using our processing abilities, and we make sense of that information with our executive functioning abilities. And we'll talk about what those are. And then we have to apply our language abilities and social cognition, okay? So those are two, that's sort of the next part that we go through. And then finally, after you filter through all of that, then there's what we think of as social communication behaviors. And an example is being able to resolve a peer conflict, okay? But you have to be able to have all these abilities and be able to do it effectively to be able to be what we think of as competent in social communication. So let's kind of start with the bottom. So when we think about executive functions, have you guys heard of that term before? Okay. So, you know, just very briefly, what it is I take information in, okay, and then I have to be able to know what to do with it, right? And that can be, you know, when we think about verbal information, the words that someone says to me, I have to be able to understand them and then kind of organize them. And as well as nonverbal information, how people, you know, what people's body language or facial expressions are telling me. And then, very quickly, I have to formulate a contingent response. Somebody says something, and then I have to kind of access my knowledge, right? My social knowledge, my experiences that have led up to this point, right? Even what people have told me I should do. You know, that's what we try to do with our kids, you know, though I don't think it works that well. I think the experience is a little better. And then it involves a degree of, I have to be able to understand the other person's perspective. I have to be able to understand what their intention is, you know, in terms, and be able to make some judgments about that. And that all takes place in a second. And then we are able to sort of formulate our response. So, does that make sense? Very brief. We could spend 90 minutes talking about executive functioning. Okay, so, and then you've got this other part which involves really just taking the information in. The auditory processing, the visual processing. You know, when a message is transmitted, am I understanding it? Am I able to receive what that message is? Attention, you know, really is, you know, I probably should have put this first, right? Because this is almost the first gateway where you have to be paying attention to what someone else is saying. Then I have to be able to understand, process that information. Shared joint attention. Are we talking about looking at the same thing at the same time so that there's a context that we're both talking about, right? You know, everyone's talking about the Seahawks, right? It's an easy context to be sharing in Seattle this week, right? So, and then other sensory processing, right? Be able to not pay attention to things that we don't need to pay attention to, right? And if you really think about it, there's just this kind of low hum over here that is this, maybe it's a heater or it's just a little bit of some air coming in, a generator back behind that wall, right? But most of us just tune it out, okay? You don't even hear about it. You don't even hear it until I actually mention it out loud, right? You know, it's the same thing with touch. So most of you probably don't feel the chair pressing up against the bottom of your legs, right? Until I mention it, and then all of a sudden you're like, oh yeah, I felt that right there, right? So we are able to know what to pay attention to and tune out all of this other information that's coming into us at the same time because because we know what is the more important thing to pay attention to. Social cognition refers to also known as social knowledge. What do you do or what do you say given a social situation? These are the social rules of interaction that we learn in infancy, right? When we start being able, not infancy, but maybe 3 years old, I guess I'm exaggerating a little bit, but you know, when kids start to be able to play interactively, this is what they're doing. They're building their social knowledge about how do I interact with other people, right? So, and also the ability to know how to modify what you do or what you say given a social context. So language we know, okay, we're not going to go over language again, but it's an important component. If you don't have the language abilities, you don't understand or you're not able to express, then you're going to have a hard time with social communication. Nonverbal communication is another important part of this. And when we think about nonverbal communication, the big one is eye contact. And we'll talk a little bit more about nonverbal communication later. But it also refers to our gestures, right? It refers to our facial expressions, even intonation or inflection, imparts a lot of meaning, right? So a funny example from when my kids were young, I have a 12-year-old and a 9-year-old now. But when they were a little bit younger, my son must have been 4, and my daughter was probably 7. And she had him in hysterics because of just this one little thing. And it was just this little purple piece of thread, okay? And she looked at it and she said, "Look at this awesome purple piece of thread," right? And then she'd turn around and say, "Look at this awesome purple piece of thread," right? And he just thought it was hilarious, right? And she kept doing it over and over again. My wife and I were like, how long are they going to do this? But it kept going, and it was like, but he got it at this very, very early age that two different things meant completely different things, right? The way of saying things is very important, okay? So, kind of quick mention here, in a multicultural society that we live in, there are cultural differences, and this is something that we also need to pay attention to. Some cultures, making direct eye contact for a child to an adult is frowned upon, okay? And when we think about children with autism, and we're asking parents, well, do they make good eye contact? That may be a question they can't answer, or maybe that's not the most important question based on their culture, okay? So certainly something to kind of think about. And then social reciprocity. So this is where we're kind of getting to the end here, right? I have to be able to kind of the ability to take in all this information, right? Know what to do with it, formulate a response, right? And then sustain it, So if I'm having a conversation at a party and I'm able to kind of like take in the information, I'm looking at them, I'm reading their nonverbal cues, I'm listening to what they're saying, I'm accessing my personal knowledge about other situations that are kind of like this. I decide if I'm going to ask a question or if I'm going to relate my own personal story about that topic, and it all happens like that, right? And that's where it's really hard for children who have social communication deficits, right? This ability to be reciprocal. And really when it comes down to what autism spectrum disorder is, it's a deficit in this ability to be reciprocal socially for a sustained period of time. Okay? So when we think about social communication, it is really this idea of putting it all together, right? We think about using language and nonverbal communication to communicate socially, coordinating our words, our gestures, our facial expressions, our eye contact, our affect, right? We're paying attention, we're using our executive functioning skills, we're accessing our knowledge, we're being reciprocal, we're understanding these cultural differences, right? It all kind of comes into to one thing, okay? So here's a picture, all right? So I'm going to ask you guys a question. So there's no words here, but what would you say this kid is communicating? I'll call on you if there's no hands. Anybody? Yes, please, thank you.
My dog.
Look at my dog. Exactly. He's showing you something, right? That is a reason for communicating, right? I want to show you something. How about his face? How's he feel? Yeah.
Well, he just seems happy and also interested in the person taking.
Right. So he's making eye contact. He's smiling towards somebody, so he's expressing a feeling by using a facial expression, right? If he, as he said, if he was saying words, he would say, "Look at my baby here." Okay? So social communication ultimately comes down to context, okay? I'm going to tell you a short story, true story that happened to me, okay? Katie, you might have heard the story, so I apologize. But so in Seattle, everybody knows that May is Bike to Work Month, right? So, in May, there's just armies of bikes, going down the Burke Gilman, they're just bikes everywhere, right? So, and I like to ride my bike. I ride my bike a lot, okay? But today I'm driving my car to work, and when I'm on my way to Children's Hospital, I have to cross, I get to this part where I have to take a right, and the Burke Gilman Trail kind of comes over, past me right next to me, and then ends up kind of going up around Lake Washington, right? So I'm sitting there, I've got a red light, and there's this whole, stack of bikes that are, maybe 20 bikes that are getting ready to cross the street, right? And I'm like, maybe I should take a right on red here, all right? So I'm kind of inching up a little bit, and just as I was about to start going, the light turns and all the bikes start going, and I have to kind of slam on my brakes so, I'm not going to hit anybody, but I'm pretty far away. So most of the people kind of look at me and be like, all right, you're not crazy, and keep going, right? But there's this one guy, and he stops, right? He stops, and he's just glaring at me. He's like the meanest look, and he's like standing right in the middle of the street, right, with his bike. And I grew up in New England, right? I'm from Rhode Island. And when somebody does that to me, to most Rhode Islanders or people from the East Coast, we usually say something like, come on, right, like that. Throw our arms up and say, come on. But he interpreted it as, come on. Right? Bring it, exactly, right? And, and then he's still looking at me, still glaring at me, and then he goes and says, well, if you want to get out of your car and discuss it, why don't you come out of your car, right? Which I ignored correctly and kept driving to work, okay? But that situation, right, so much communication going on with very little words, right? There's facial expressions, there's gestures, there's interpreting gestures, there's misinterpreting gestures, right? And there's some words and some decisions on my part about, should I get out of this car and discuss this with this crazy biker, right? And making the correct choice, right? So that, ultimately that's what communication is, right? That's what we need to be able to do every day, right? And that's what a lot of kids who have social communication difficulties have a problem with. So I'm not going to read all about this, but this last year, the Diagnostic and Statistical Manual 5 came out. And there's a brand new diagnosis that was part of it. And it's called Social Pragmatic Communication Disorder. And prior to this, there was really nothing that said, there's this thing called social communication disorder in children. So kind of one thing that, this information is right online. You can find this if you're interested in it. Kind of the important part of this is if a child can't have social communication disorder and have autism, right? But most children with autism, as you'll see from this slide, okay, have social communication impairment as what it is a requirement in order to get the diagnosis, right? A child must have social communication delay in order for to have the diagnosis of autism, okay? So that's kind of what the model is. So I've got another 30 minutes, and I'm just going to kind of bust through some different levels of social communication, kind of starting at an early age and then getting up through conversations. But does anyone have any questions about the model or comments about what we talked about? Yes, please.
I'm curious about assessments.
Yes.
To that model.
Great question, and I cover that at the end.
Thank you.
So how early can a child be diagnosed
With
autism or
Well,
on the spectrum?
I mean,
So there is no language till a certain age, or?
I mean, we're able, so prior to working here, and prior to being in Seattle, I worked out on research at the Kennedy Krieger Institute in Baltimore, Maryland. And the research that we were doing was really targeting the early identification of autism. And we were able to identify pretty clearly as young as 12, 14 months old. Okay? That's certainly not all kids, and that was certainly the kids who probably had more significant autism. Okay? And what this research study did was it looked at siblings of children with autism who they had a genetic probable predisposition to having autism, and we're watching them starting at 6 months. We were not able to identify them at 6 months, right? But by 12, sometimes they'd come in between 12 and 14, and then by 18 months, we're like, yeah, this child definitely has autism. At the hospital, I think that we often are seeing kids as early as 2. Sometimes it happens later, especially for kids who are, quote unquote, high functioning autism. They may have their language develops kind of on time. Usually that first red flag is the parents say, my kid's not talking, what's going on, right? And that usually brings them into birth to 3 centers, and then they say, well, maybe you ought to go and I don't think this is just speech and language. Maybe we should investigate a little further. Okay. So let's kind of talk a little bit about the foundation of social communication. And when we think about where this foundation is, these words engagement, and I'll talk a little bit about joint attention. And I'm not going to spend too much time on imitation, but imitation is certainly an important part of how we interact. Is one of the main ways that kids learn at an early age is they watch their parents do something, they watch other children do it, and then they imitate it. Okay, and there's a social component to imitation in those contexts, right? So engagement refers to this idea of feeling connected with other people, right? And the question that you ask, and I think this is a really valid question, is what's the motivation to be social? Right? When we think about kids with autism, this is really sometimes one of the biggest obstacles. They're not motivated to be social. How do we encourage, how do we teach a child to care to be social with other people? And it's not an easy question to answer, right? I'll try to talk a little bit about some ideas, that I feel like can be helpful. Engagement refers to how you initiate social interactions, how you respond to social interactions. Lots of times engagement is measured by attention. How attentive is this child? How engaging are they, right? How well do they make and sustain eye contact with people, right? And this idea of coordinating, at very early age, kids start to coordinate their facial expressions and eye contact during situations, okay? Joint attention is another really important early concept. It's a cognitive ability that children develop, usually around 1 year, right? And it's the ability to share attention around something, even earlier than a year. So when you're looking at a book with your kid, right, and you're saying, oh, look at that, there's a rhinoceros, right, and you point to a picture and their eyes move to where you're pointing to, that's shared joint attention. That's, I'm looking at something at the same time as you, and this is a primary way that kids learn, right? We're paying attention to the same thing. I say a word, right? They hear the word, they see the picture, and that's how vocabulary is increased, right? One of the common tests that we use at children is to measure this is how well do they respond to your attempts to shift their attention. If I do this and I say, hey, look over there, right? You kind of know that there's an invisible line between my eyes and the exit sign over there where I was looking, right? Or if I point to it and say, hey, look over there, right? That's earlier, that's easier, So when we're looking at children with autism, that's something that we're often examining is this ability to, how can I shift their attention to something that is over there, right? It's thought of as the earliest social skill, okay? Sometimes lots of questions will arise. Well, what about even before this, right? Well, what about pre-verbal children, right? What can we do? Even kids who might be pre-intentional in terms of their communication. They're not at the point where they're intentionally communicating by taking someone's hand and bringing them somewhere, right? With a lot of the parents are interpreting their behavior, and we need to be able to help them kind of get to this level where they are intentionally communicating. And there are some different, when children have language delays, there are other means that we can use for communication. Sign language can be effective for kids who are nonverbal, as well as something called the picture exchange communication system. It refers to pictures that are taken and handed as a way of communicating. And with technology today, there is a heck of a lot of opportunities for augmentative and alternative communication, and iPads and other mobile technology have become almost commonplace in terms of schools and kids who have communication deficits. But the goal here, when it comes down to it, is we want to provide and create what would be considered a functional communication system. And a lot of the behaviors that you see, and you know, I'm not going to spend a lot of time about behavior, but when a child's not able to communicate, they might act out, right? They might get frustrated. They might use behavior as a way of communicating. And what we want to do is provide a functional communication system so that they recognize the power of communication. Okay, that's what it is, right? You have this power to be able to kind of get what you want, right? So, kind of the next level, you know, after we get past this shared engagement and shared attention, is what we think of as the variety of communicative intentions. Why do we communicate? And at an early age, we can kind of think about some specific reasons, right? Kids communicate to get other people's attention, right? They will communicate to ask for things, or to say no, to protest, no thank you, or reject things that are being offered. Social reasons, like I'm just making a comment. A baby might just hold something up, right? Just to show you, hey, look at that, right? Or right? Using their eye contact, holding something up, using a gesture. Hellos and goodbyes, and just being able to respond to other people, right? So there's a lot of different reasons that we want to communicate. That's something that when we think about an evaluation, that's what we ask. We take a look at, is there a variety of communicative intentions? So protests is one that can often be problematic, because very often when we're saying no, there's an emotional part of it, right? No, I don't want to leave the park. No, I don't want to go to bed, right? No, I don't want to get into the bathroom. So a child might use a variety of different reasons, you know, different ways of communicating protests. Maybe they just push people away or turn away. Maybe I've had kids who will pry my fingers off of something in order to get it. And then more conventional ways like shaking their head, right? Verbally saying no. But there is this connection with emotional regulation. And lots of times kids, just because they're feeling frustrated in the moment, their communication abilities drop. And then behavior like I'm pushing away or I'm getting upset becomes the way of protesting, okay? Commenting, as I mentioned earlier, you comment that this is communication that is kind of outside of the I want something, right? This is communication that is just, I'm interested in this, I'm interested in you, and I want to show you what I'm interested in doing. There's not a lot of I get something, right? So when we think about kids who are on the spectrum, this is something that we don't see as often. It's a question that I'll often ask, right? Why does a child communicate? Do they only communicate for their own needs, right? Or are they communicating for more social reasons, like I'm going to show you something, I want to point to something out there that I think is interesting, making verbal comments, right? And when we go back to joint attention, are they trying to shift other people's attentions to things that they like, by pointing, looking, and making sure that you're looking at what they're trying to point to. So sometimes we have kids who are good labelers, and this happens very often with kids on the spectrum, where they just start labeling things that they see, right? But the social part of it is important. Are they using their eyes to coordinate the comments to make it social, right? So here's an idea just as a strategy. So as I said earlier, lots of times it's not easy to kind of motivate a child to make social comments. Why would they want to do that? So, and my experience here is we just have to try to provide them with a lot of positive experiences with shared enjoyment, right? If you're able to have, when we create friends, when we develop relationships with other people, very often it's because, hey, we had a good time together, right? When we think about our kids with autism and other social communication deficits, they don't have a lot of good times. They haven't had this foundation, right? Somehow we need to be able to provide them and support that interaction that allows them to learn, I want to be with other people. I want to be social with other people. I want to share interests around things. So here's an example. This is something that we developed back actually in Baltimore. So you've got a classroom, and very often, especially in a preschool, there's like a theme, right? We have an animal theme. We're reading brown bear books. We're singing songs about animals. So this could happen in the classroom, or it could happen at home. And you get a picture of the brown bear or the red bird or the green frog that is in the book. And you maybe take that picture and you put it up somewhere. All right, it's just up on, let's say you're doing this at home. It's up on the bathroom mirror, right? You've learned that they're going to be using this book at school. We're going to try to help provide opportunities at home too. There's a picture of Brown Bear, and there he is on the mirror, right? And at the beginning, you're doing a lot of, look, there's Brown Bear, right? Next day, you move it to a different spot. It's on the refrigerator. Next day, it's in the car, right? So it takes a little work to kind of move this thing, this picture elsewhere, in different places every day. But every day, you're kind of creating this opportunity, right? You're creating a routine that is a social routine. And at some point, hopefully with a lot of practice, there's Brown Bear sitting on the kitchen table, and the child comes in and says, "It's Brown Bear," right? Because you've set up a lot of opportunities. And then your response, the parent's response, is such that it reinforces that comment, right? So yes, it's a bit contrived in this situation, but it's providing an opportunity. You're using a routine, which is something that kids learn well by, okay? And it can be effective. So let's talk a little bit about nonverbal communication. And as I mentioned earlier, it refers to eye contact, facial expressions, and gestures. So I'm going to spend a little time talking about eye contact because I think it's really important when we think about how we communicate with other people. It really is how, most importantly is how we interpret incoming information, is all this visual information that we need to be able to pay attention to and know what to do with. So being able to pay attention and look at people is important. The facial expressions is, again, and gestures, a lot of people will use these skills. What I want to see is children be able to interpret the facial expressions in other kids. I think it's almost important. If I'm going to create a goal, I want a child to be able to interpret that facial expression or interpret that gesture in other people. It's great if they learn how to use it too, but when we're thinking about managing social interactions, that's more important to me. So eye contact, and autism isn't the only issue that can have difficulty with eye contact. Lots of times kids who have attention deficits also don't use eye contact effectively to kind of read, interpret other people. So just to talk a little bit about strategies, I find instead of, I've found that the direction of sort of look at me isn't the most effective way of increasing eye contact. Even children, I've seen, and I have tried taking a kid's head and moving it, to get them to look at you, and usually they're like looking around like this, right? So what is a lot more helpful is to kind of try to provide some opportunities and almost some indirect type prompting so that they ultimately look up on their own. Because eye contact really just has to kind of come from within. Even when I say, "Oh, look at me," they're following an instruction. And that's probably not going to stick. It rarely sticks, right? It has to kind of be like, I need to look up you to figure out what's going on. So indirect cues really just kind of refers to pausing, right? A child comes up to me and says, "Oh, will you open these bubbles for me, please?" And if I just kind of wait for a second, and then they ultimately kind of look up, then I can reinforce, oh, you want some bubbles, and then I'll open up and blow. Okay? So it really is just kind of trying to hold out a little bit without saying, oh, well, you're not getting the bubbles unless you look, right? That's probably not going to work either. So there's got to be some kind of middle ground there where we're thinking about encouraging eye contact. Even just at an early age becoming interesting. For example, a child who has autism might just get really stuck or interested in objects. But how do you become interesting to the child so that may increase eye contact that way? And a really good strategy I've found is really just thinking about, and this might seem strange coming from a speech-language pathologist, but stop talking, right? Is you just take language out of interactions and try to communicate non-verbally, right? Like, we're going to spend 5 minutes and communicate using pantomime and gestures. And it's amazing how a child will start looking up when you've kind of set that context, right? Even playing a game. Say we're playing a game of Uno or Trouble or something, and we're saying, all right, here's the rule, there's no talking, right? And just to be able to say, it's your turn by looking up and making eye contact is great practice. And then kids start learning that, oh, I need to get information. Even just on an IEP, I think a goal that says a child will use eye contact, will coordinate eye contact when asking for permission, right? If they're able to ask permission but they're not making eye contact, it's a measurable goal. It's something that you can set up a lot of opportunities for, and I like seeing that goal on an IEP. So I want to spend the last couple of minutes here talking about conversations, and then we'll quickly talk about evaluations, and we'll be done by 8:30. So conversations is sort of the end result of all of this, right? The ability to have a back and forth reciprocal conversation is, sort of the final ability that we all need to be able to do, right? And what are these things that involve that relate to conversations? You need to be able to ask and answer questions, right? You have to be able to answer questions that involve a little bit of processing. I have to think about what your answer is. It's not just an immediate response. We have to be able to relate personal events. We have to be able to ask relevant questions. There's lots of questions out there that we could ask, but they may not all be relevant to this particular context, right? So, and then we also need to be able to know how to take turns during interactions. Narratives refer to the ability to just tell our personal stories, right? Talking about the past, relating events. The number one question that kids have a heart that do not answer after when coming home from school: how was school today? What did you do at school today? It doesn't matter if you have a language impairment or not, right? So, difficulty with organization, sequencing, recall, being able to, even though they have these great memories, they have a hard time being able to recall and be able to sequence what happened. And being able to retell stories that they read about or saw in a movie or a TV show. So a strategy that I really I love this strategy is really just kind of creating your own books, taking a child's own stories and creating a personal narrative that is very, very, very sort of linked to their own lives, right? Their own personal experiences. They go on a vacation, they have a birthday, they go to a special event, creating stories. And now, I don't have my phone on me, but now there's apps that just do it all for you. When I started, I had to take pictures and then bring them to get developed somewhere, wait a couple of weeks, and then create this book using tape, right? And paper. And we don't have to do that anymore. It's so easy. I have my phone, I can take the pictures with it, and they go right into the app, and there's my beautiful story. It's so easy. So, but this is a great, great opportunity for kids to be able to tell stories. And then conversations refer to this back and forth verbal exchange of information, the stories, the sharing, right? It requires all of those things that we talked about earlier when it comes to, in terms of social communication, being able to do all of these things, the questions and relate events, and then all the nonverbal behaviors that go along to it. And most importantly, we need to be able to adjust to the context, right? Change our ability, change what we're going to say based on the person that we're talking to, right? So, and a strategy that I've had success with conversation is, and this requires reading abilities. So I haven't had conversations I find are very difficult to work on, but as soon as a child has ability to read, even almost kind of simple, basic reading, it opens some doors in terms of treatment. And a strategy that I will use is just kind of writing down the different turns, right? Almost as if you were writing a play, right? Jim said this, and then Johnny said this, right? And then going down the line. And it allows you to take a look at, okay, I said this, what would be a good question to ask after I said that, right? Or I said this, you said this, did that make sense based on what I said? So you can kind of go back and take a look at it and really be able to just talk about it. And then when we've had a nice exchange all the way down, then we can practice it. We read it just like we would in a play. And it gives kids that almost a feel of, this is what it feels like to have a back and forth conversation. So here's just an example. And then when earlier I talked about what a relevant question would be. A lot of kids they may ask questions, but the questions aren't necessarily the best questions that they could ask in that situation. So if I said something like, oh, well, I went to the airport this morning, right? There's a whole list of questions that might pop into your mind, but who knows the best one? Where did you go? Or why did you go there, right? So, but what I'll do is I'll create like a question box down at the bottom. And those are the question words, those are the questions that you could ask. Let's pick one of those questions, and now what are you going to say, right? And then we can work on sustaining conversations in kind of the same way. So, and then conversational development doesn't just stop when we're with turn taking and being able to main topics. It is this whole complex system that often needs continued support, continued encouragement. A great opportunity are social skills groups. A lot of kids now, a lot of schools are providing social skills group, a lunch bunch or a game club or a book club. I love book clubs in this context. A recess group or something like that really provides an opportunity for kids to be able to practice the conversational skills that they may be learning in individual therapy in a context where they might have someone who can still help to support it. So, and these are just a list of some disorders that are kind of more broadly related to communication. I add anxiety on there because a lot of times, a lot of the kids that we see at Children's, if they don't have, sometimes they come in and they've got an anxiety disorder. And I see them in their communication when they're anxious just drops, right? So just that context, like teaching kids to use their language skills during an anxiety-provoking situation. That's a great goal. So let's talk about evaluation right here at the end. And it's a problem, right? Social communication, to evaluate it properly, there are no good standardized tests. I'll say that, okay? There's some that have been developed, but most of the often they're looking at what we think of as social knowledge. What do you do? What should you do or say given this social situation, right? And it's a problem because a lot of school districts still rely on, a certain percentage based on a standardized assessment. And social communication, something that is so based on context and can vary so much depending on the situation, is going to be hard to assess in what we think of as the conventional evaluation assessment. So I'm always a proponent of really trying to examine social communication across contexts. The standardized tests, as I said, they don't necessarily pick up on the social communication. So if you're going to use standardized tools, and that's good to examine those language abilities, and even looking at social knowledge, right? I think that some of those pragmatic social communication tests do a decent job of identifying, yes, you know what you should do or say in this situation, okay? The next question is, do you do it, right? And that is often where the lapse is, right? So assessments really should consist of a combination of the structured testing, the observations, parent and teacher report. Just to say at the end here, children with autism, some children with social communication disorder, they will score within normal limits on what we think of as conventional standard language tests, looking at receptive and expressive language. And sometimes these kids do need communication-based therapies to work on more of these broad social communication deficits. Okay, so these are a couple more places, a couple of more things to look at. The Hannah Center's back. More Than Words looks at more broadly social communication abilities, and this social thinking is was developed by a speech therapist down in California, and does a really good job of providing ideas and strategies about how to target social communication skills. So kind of take-home messages here. Parent involvement so crucial when it comes to whether it's speech, language, or communication, whatever it is we're targeting. Targeting communication really requires this team approach. Teaching parents what to do is really important. If you have 1 hour speech therapy a week, it's not going to do it. It's not going to cut it if that's the only 1 hour a week that you're working on communication, right? Speech therapists are often really good at giving homework, asking, providing ideas and strategies. Hey, let's work on this area these couple of weeks. I think I see this as an emerging skill. And if your teachers, ask your SLPs to come in and say, what are some things that we could do as a whole classroom situation to be able to provide this added support. So, I think that's kind of what I had to say. So, and it's 8:32, so I'm 2 minutes over. So, but I'm happy to take questions, and and if people want to go and come up and talk individually, I'm happy to do that too. Any questions?